Hello everyone, Dr. Mandell here. As we get older, the eyes become one of the first parts of the body to show signs of aging. Blurry vision, dryness, difficulty seeing at night. These challenges are extremely common. But here's the good news. There are specific foods seniors can eat every day to protect the eyes, sharpen vision, and even slow down degenerative conditions like macular degeneration and cataracts. Today, I'm going to share the best foods for your eyes, the science behind why they work, and how you can start using them daily. Your eyes are the only organs that let you witness every moment of your life, yet they are also the organs we tend to protect the least. And as the years pass, the truth becomes unavoidable. Your vision does not fade by accident. It fades because the cells inside your eyes are starving for nutrients they were designed to receive every single day. Today, you're going to understand exactly why certain foods, simple everyday foods, hold the power to protect your vision, sharpen your sight, and slow the very processes that cause age-related blindness. And once you hear the science, you will never look at your plate the same way again. Because inside your eyes lives a delicate system, thin layers of tissue, microscopic pigments, blood vessels no thicker than a strand of hair. They depend on specific vitamins and antioxidants to stay alive. The moment those nutrients disappear from your diet, damage begins silently. You don't feel it, you don't notice it, until one day the world starts to look a little dimmer. And by then, years of harm have already been done. But here's the part most people never hear. The nutrients your eyes need are not rare. They're not expensive. They are sitting in everyday foods: carrots, spinach, eggs, berries, salmon, foods that contain molecules so powerful, scientists have proven they can actually slow macular degeneration, reduce cataract formation, and support night vision. Let's start with the pigments your eyes depend on to stay sharp: lutein and zeaxanthin. These are not ordinary antioxidants. They are the only two antioxidants that naturally accumulate in the macula, the tiny central part of your retina responsible for detailed, precise vision. Without them, the macula weakens. But when you eat leafy greens like spinach, kale, or collard greens, these pigments travel directly to your eyes and form a protective shield. And here's the shocking part. Studies show people who consume high levels of lutein and zeaxanthin have up to 43% lower risk of age-related macular degeneration. That's not a small difference. That's the difference between reading your grandchildren's faces clearly or seeing only shadows and blurred outlines. And it doesn't stop there. These pigments act like internal sunglasses, filtering out high-energy blue light. Blue light is powerful enough to penetrate all the way to the retina and create oxidative stress. This stress destroys photoreceptor cells, cells you cannot replace. Once they're gone forever. But lutein and zeaxanthin neutralize that damage before it happens. They stand between your eyes and the light trying to harm them. Then there's vitamin A, the nutrient that keeps your cornea healthy and enables your eyes to see in low light. Foods like carrots, sweet potatoes, and pumpkins don't just contain vitamin A, they contain beta-carotene, which your body converts into exactly the amount of vitamin A your eyes require. Without vitamin A, the surface of your eyes becomes dry, inflamed, and unprotected. In severe deficiency, night blindness develops, making it nearly impossible to see when the lights dim. That's why you often hear carrots are good for your eyes, because they literally help your eyes form the pigment rhodopsin, which allows you to see in darkness. Without enough beta-carotene, your eyes simply cannot adapt. But the story gets even deeper when you look at omega-3 fatty acids, especially DHA. Your retina is loaded with DHA. It makes up nearly 30% of the total fat in the central retina. That's how important it is. DHA supports the structure of photoreceptor cells, improves the fluidity of cell membranes, and helps your eyes send signals to your brain with clarity and speed. When seniors don't consume enough DHA, the retina becomes dry and brittle. Tear production weakens. This is why dry eyes are one of the most common age-related conditions. But just 2 servings of fatty fish per week, salmon, sardines, mackerel, can improve tear stability and reduce chronic dryness. This is not guesswork. Clinical studies repeatedly confirm it. Then you have vitamin C, one of the strongest protectors against cataracts. Cataracts form when the lens of the eye becomes cloudy due to oxidative stress. Over time, proteins in the lens clump together, blocking light. But vitamin C, especially from citrus fruits and berries, reduces this oxidative damage. Researchers found that people with higher vitamin C intake had significantly slower cataract progression over 10 years. That means the simple act of eating an orange, a kiwi, or a handful of berries each day can delay the clouding of your vision. And we cannot ignore vitamin E, found in almonds, walnuts, sunflower seeds, and other nuts. Vitamin E protects the delicate cell membranes within the retina from oxidative harm. When these membranes stay intact, your eyes remain hydrated, protected, and functional. Seniors who consume enough vitamin E have lower rates of age-related vision decline. It is one of the simplest yet most overlooked nutrients for eye longevity. But here's something even more remarkable: eggs. Egg yolks contain lutein and zeaxanthin, just like leafy greens, but the body absorbs them far more efficiently from eggs due to the natural fat content in the yolk. Think about that. You get the same protective antioxidants, but in a form your body can use better. That means one egg a day may do more for your eye health than a bowl of greens. That's how powerful bioavailability is. Tomatoes, broccoli, and red peppers deliver another layer of protection. Lycopene and vitamin C. Lycopene is a pigment shown to reduce the oxidative stress that damages retinal cells, especially in seniors exposed to UV light. It acts as a second shield, preventing the retina from degrading under constant exposure. These foods aren't trendy superfoods. They're foundational. They're the nutrients your eyes were biologically built to rely on. Without them, deterioration begins. With them, deterioration slows, sometimes significantly. And if you look closely at regions around the world where seniors maintain sharp vision well into their 80s and 90s, you'll notice one thing. Their diets are naturally rich in these compounds. They eat leafy greens. They eat colorful fruits. They eat fish. They consume nuts, seeds, and simple whole foods every single day. Not because they're trying to boost their eyes, but because those foods are part of a traditional, nutrient-rich lifestyle. Now contrast that with modern diets. Processed snacks, sugary foods, refined carbohydrates, fried meals. These foods strip the eyes of protection. They increase inflammation. They raise blood sugar. They accelerate the breakdown of retinal tissue. Vision loss becomes not just a possibility, but an inevitability. But here is the message that matters most. It's not too late. Your eyes respond quickly to the nutrients they've been missing. Studies show that boosting intake of lutein, zeaxanthin, vitamin A, vitamin C, vitamin E, and omega-3s can improve eye function within weeks. Vision becomes clearer, dryness decreases, night vision sharpens, contrast sensitivity improves. The cells inside your eyes begin to receive the nourishment they've been deprived of, sometimes for years. Every bite you take tells your body what to strengthen and what to weaken. And when you choose foods rich in these eye-protective nutrients, you are choosing to preserve the very sense that lets you experience the world. Your vision does not have to fade at the speed it's fading now. Your eyes are not destined for decline. They are waiting for fuel, real fuel, natural fuel, the nutrients nature designed specifically for them. And once you give your eyes what they need, clarity begins to return, not overnight, not magically, but steadily, silently, surely. What you put on your plate is either feeding your eyesight or stealing it. The science is clear. The choice is yours. Your vision is not only shaped by the foods you eat, it is quietly destroyed by the foods you don't think twice about. And what's most shocking is that the same foods sitting on kitchen tables across the world are accelerating blindness in millions of seniors every year. Not because the foods are strong, but because the eye is fragile. Inflammation, blood sugar spikes, and oxidative stress are not just health terms. They are silent forces that slowly attack the retina, weaken the lens, damage blood vessels, and dim the world right in front of you. The danger isn't loud. The danger is subtle, creeping in meal by meal, year by year. Most people never hear the truth. Vision decline in seniors doesn't simply happen with age. It happens with diet. The wrong foods act like slow poison to the eyes. They trigger the exact biological processes that lead to blurry vision, diabetic retinopathy, cataracts, macular degeneration, and chronic dryness. And once this damage builds up, reversing it becomes incredibly difficult. But that's why understanding the foods that harm your eyes is just as important as the foods that protect them. Let's start with the biggest culprit, sugar. When seniors consume sugary foods, soft drinks, pastries, cookies, white bread, desserts, their blood sugar doesn't just rise, it surges. And when blood sugar spikes repeatedly, Excess glucose begins attaching to proteins in a process called glycation. Glycation creates advanced glycation end products, or AGEs. These AGEs cause inflammation and stiffening of tiny blood vessels throughout the body. The retina is full of fragile capillaries only micrometers thick. When ages damage them, they leak, they swell, they bleed. This is the beginning of diabetic retinopathy, the leading cause of blindness in older adults. And you don't need diabetes for sugar to hurt your eyes. Even people with normal blood sugar experience accelerated retinal aging when their diets are high in refined sugars. Studies show that seniors with the highest sugar intake have a significantly higher risk of retinopathy, macular degeneration, and cataracts. Why? Because sugar doesn't just hurt blood vessels, it damages the lens. When glucose levels remain high, the lens absorbs that glucose and converts it into sorbitol, a substance that creates osmotic stress. That stress leads to clouding of the lens. That clouding becomes cataracts. In some studies, high sugar diets speed cataract formation by up to 50%. It's not age, it's chemistry. Then there are fried foods, French fries, fried chicken, packaged snacks cooked in cheap vegetable oils. These foods contain oxidized fats that create inflammation throughout the body. When consumed regularly, they increase the oxidative load placed on your eyes. The retina, being one of the most metabolically active tissues in the entire human body, is especially vulnerable. It needs a constant supply of oxygen and nutrients to maintain vision, but when bombarded with oxidized fats, inflammation builds and photoreceptor cells begin to break down faster. Once those cells die, they cannot be replaced. Researchers have repeatedly found that diets high in fried foods increase the speed of retinal aging and raise the risk of macular degeneration. One study even found that people who ate fried foods more than twice a week had significantly thinner macular tissue, a sign of early degeneration, even before symptoms appeared. The damage happens before you feel it. That's what makes it so dangerous. Refined carbohydrates, white bread, pasta, pastries, processed cereals, may look harmless, but they behave like sugar once inside the body. They trigger the same blood sugar spikes, the same glycation, the same damage to retinal vessels. In fact, high glycemic diets are directly linked to macular degeneration. When the retina is starved for oxygen because blood vessels are damaged, the eye tries to compensate by growing new vessels. But these new vessels are weak and fragile. They leak fluid and blood, leading to the wet form of macular degeneration that can cause rapid vision loss. Something as simple as replacing refined carbs with whole grains has been shown to reduce the risk of macular degeneration by up to 49%. That's how powerful food choices are. And then there's salt. Most seniors don't think of salt as harmful to the eyes, but excessive sodium increases fluid retention and raises blood pressure. High blood pressure is one of the most damaging conditions for the tiny arteries in the eyes. When pressure rises, those vessels stiffen, narrow, and eventually weaken. This reduces blood flow to the retina and optic nerve, starving them of oxygen. Over time, this accelerates glaucoma and hypertensive retinopathy, conditions that often go unnoticed until permanent vision loss has already occurred. Too much salt doesn't hurt immediately. It hurts slowly, quietly, but relentlessly. The modern diet, rich in sugar, refined carbs, fried foods, and salty processed snacks, creates the perfect storm inside the eyes. Inflammation rises. Omega-6 to omega-3 ratios become imbalanced. The tear film becomes unstable, causing dry eyes. Blood vessels weaken and leak. The retina loses its protection, and the lens starts to cloud. This doesn't happen because you're getting older. It happens because the foods designed to nourish your eyes are being replaced by foods that destroy them. And what makes this so tragic is that most seniors have no idea. They blame genetics, they blame age, they blame luck. But the truth is much more empowering and also more urgent. What you eat today becomes the vision you will see or struggle to see tomorrow. When you remove sugary foods, your blood vessels begin healing. Inflammation decreases. Retinal swelling goes down. Visual clarity improves. Some seniors even see measurable improvements in eye pressure, night vision, and dryness in as little as 4 weeks. When you reduce fried foods and processed oils, oxidative stress decreases dramatically, giving the retina breathing room to repair itself. When you lower refined carbs, blood sugar stabilizes, reducing the assault on retinal tissue. And when you cut back on excess salt, blood pressure drops, restoring healthy blood flow to the eyes. Your eyes are not failing you. They are reacting to the fuel they're being given. And the moment you start removing the foods that trigger inflammation, oxidative stress, and vascular damage, your vision begins to protect itself again. Because vision loss does not happen in a single moment. It happens through the sum of small choices, foods you eat daily, habits repeated over decades. But that also means improvement begins with small changes too. Swap refined carbs for whole foods. Trade sugary snacks for fruit. Replace fried foods with baked or steamed meals. Choose oils that support your health instead of harming it. Every step away from damaging foods is a step toward clearer vision. Every day you avoid inflammation is a day your eyes heal instead of breakdown. The power to slow vision loss is already in your hands, and the foods you avoid today may be the very reason you see the world more clearly tomorrow. Your eyes work for you every second of every day, so give them the nourishment they deserve. These simple foods can make a world of difference, helping you see clearer, sharper, and healthier as you age. Take care of yourself, take care of your vision. I'm Dr. Mandell, and I wish you great health.